Well, if you are struggling with your mental health, it is important to know you are not alone. Every year, millions of people in the U.S. are affected by mental illness. More than 1 in 5 adults experience mental illness each year. It's also important to know there are plenty of resources, support, and treatment options. And to highlight some area resources, we have Christy Buck, CEO of Mental Health Foundation of West Michigan. Be Nice. Thank you for being here with us. You know, when it comes to getting mental health care, Christy, what are some myths, some stigmas that you continue to notice that are still out there?
Well, one thing is, for sure, what we know is that mental health disorders can start at a very young age. And so it's being on top of it and looking for changes in people's behaviors, their feelings, their actions. 50% of mental health disorders come on by the age of 14 years old and 75% by the age of 24. So if you can find it when it is, I would say, at the start, at those onsetting stages, then people can actually get better faster, and there's more hope for recovery. That means people to live the life that they want to live.
Absolutely. You know, when someone has gone through something, right, a mental health struggle, and they've recovered, they're better, they can help so many people, right? Talk about the importance of peer support.
They sure can. And I know last week we spoke about the Navigate program, and that's so important. And those are programs that actually have employed certified peer support specialists. And those are folks that have been trained. They go through a training within the state where they have a certificate, and it says that they have been trained in how to help peers. But in addition, you can find other people, and the more that we talk about mental health disorders, mental illnesses, these illnesses that keep us from doing the things we love, accomplishing the things that we've wanted to accomplish, when we talk about it more, people will come to the surface. Find those people that are willing to talk about depression, talk about anxiety, people to talk about bipolar disorder. There are many support groups, and oftentimes these are held through behavioral health systems. So look into places like Forest View Hospital, Pine Rest, for support groups that might be happening through their hospitals. Also, there was the Sheldon House will be speaking next week, and they're also a program that hosts programming every day for people that are living with mental health disorders. And those are commonalities. Those are things that I have in common. I look at Gilda's House as a great resource for folks that are having a journey through recovering by cancer, through their family members, much like that the Sheldon House is.
Yeah, Christy, because we've been highlighting a group just about every week, right, here on Mental Health Monday. But overall, what does it look like for those who need help in West Michigan, overall? Overall,
well, there is help. And first of all, it is recognizing when someone needs help. If someone has insurance, the starting point is typically with their primary care physician to go on and get further assistance. It could be that they may have a social worker employed, and that social worker could help them out and to navigate through where other treatment options are. And I know last week Chadwick mentioned that, you know, medications is not the only way to recover from mental health disorders. It's also by finding good treatment, good therapy, good group therapy, finding, again, these like groups where other people are like me, where they're struggling on their same illness that I may have.
And Christy, you just informed me, and I can't believe it, but we've been doing this segment for a year.
A year.
Wow, and I just want to thank you, but I know this segment is making a difference. We're hearing from these groups, but we're actually hearing from the people as well that are going through it, right? Who have struggled, right?
Absolutely. And I think, and I hope what we've done is bring a lot of information, a lot of treatment options and information regarding that, and then also where there are supports within the community to find help. But most of all, some of the stories I loved, Amber, were these stories of hope and recovery that through finding those protective factors for my mental health, meaning access to treatment and utilizing treatment, and then in addition, art, music, hobbies that I may have that I didn't even know I had, and now they've resurfaced. Finding those for myself and seeing that I can get better and having that self-awareness.
Christy, thank you so much, and for all that
I thank you for everything that you've done to help.
If you notice changes in your mental health or in someone you care about, don't wait. Take action. You can go to benice.org.